Good afternoon. Hello and happy spring. Thanks to you all for joining us today. I see lots of old friends and new in the attendee list today, so I'm so happy to have you all with us. We are so happy to have you for this exciting, I hope exciting, webinar on using and understanding your 2016 Health Center Data Profile. My name is Allison Abayasekara. I'm the Director of Training and Technical Assistance at the Association of Clinicians for the Underserved. And today we're really going to be looking at the data profiles that we shared with all health centers last week and via their CEOs, and we'll get into that. And really just want to give you the opportunity to go through it with us as a group today to find out more about what it is, and then we're available offline other times to go through your specific profile. Just some housekeeping announcements while we get started. Today's webinar is going to be recorded, so just FYI if you have questions. And then also if you have colleagues that you'd like to share this with later, we are going to make the recording available on our website very soon after the webinar. We have plenty of time for questions at the end, but if you want to share them as you think of them, please just drop them into that questions box that you should see on the right-hand side of your screen. And the last thing to know is that if you have any questions during the broadcast, any problems, any issues, you can go ahead and contact Mariah Blake, our staffer, who will help you work through those issues and make sure that you get what you need. So time's a-ticking, and I am very excited for the content today, so we can jump right in. I did want to just start with a note on who we are. ACU is a nonprofit organization focused on increasing the number of clinicians in underserved areas, as well as supporting clinicians who are already serving in underserved areas. We have a strong alignment with the National Health Service Corps, and that's our #1 advocacy and policy priority. And because of all of that work, we got set up with the STAR Center, which is really the project that we're talking about today. So the STAR Center is really a short name for what we really are: Solutions, Training, and Assistance for Recruitment and Retention. In July 2014, ACU received a national cooperative agreement from the Bureau of Primary Health Care to help health centers with resources, training, and technical assistance on their clinician recruitment and retention challenges. We are one of a large network of national organizations who are here to help health centers. So if you don't know about national cooperative agreements in your area, please go ahead and just Google it. The page will pop up and you can find out all about the other organizations that we work with and that work with health centers. But right now, we're the only ones focused directly on clinician recruitment and retention on the kind of the end side after they're all done their training. I encourage you to visit our project website when we're all done here, chcworkforce.org. You can hear all about all the things that we do. There's lots of resources there. You can check out our calendar for other webinars and in-person trainings. You can request technical assistance. All of that stuff is available on our website. So please check it out. But what we're really here to talk about today are those individual recruitment and retention profiles. Now, when we started this project a couple of years ago, you know, we had a certain goals and a certain pot of money, and we had to figure out some sort of way to identify and quantify workforce need across the country. So we dreamed up these data profiles, and they're really one-page profiles that look at a large number of data points from a group of national data sets, a lot of which health centers report in themselves from Uniform Data System, UDS, for example. And it's really a kind of a way to give you all of your data in a large number of ways, organize it into a one-pager, and help you look at it through a workforce lens and just try and see, hey, how do I understand all of the stuff I already know about through a workforce lens, and then how do I see how I stack up against other health centers, and depending on that, what might be good places for me to start as I'm trying to improve my workforce program. So here's a look at data profile looks like. It's a front and a back. The front is on the left side. The back is on the right side. This is actually the second year of data profiles. We did one in 2015, and we're doing these 2016 ones now. The 2016 ones are a little bit revised in terms of the data points. We removed some data points based on your feedback, and then we also added the back side. So we just wanted you to get a sense of what the whole thing looks like. We emailed these out to all health center CEOs last week. So if you are a CEO, check your email for an email from either me or my staffer, Mariah Blake. And if you're not a CEO, please check in with your CEO to say, hey, did we get this profile? Can we look through it together? And that's really what we're going to do today, is we're going to go through it all piece by piece so you can understand, whoa, what do all these numbers mean? What are these blue-colored flag things? How do I use this? What's the point of this? It's a lot of data, and it can be really overwhelming to people, but we really want to make sure that you understand the real power that's here and how you can use it to really look at your own operations. So here is the top. We're going to start with the descriptive section using, as you can see, a phony profile, Generic Health Center Inc. But just for the purposes of demonstration today, we wanted you to walk through one. The important thing to remember when looking through all this data and looking at this profile is that the data profile itself is really, it's just a picture. We captured it at a specific point in time. You know, I mentioned that we use UDS, and as you all know, there's a small delay in when you report UDS and when, you know, HRSA is able to go through it all and share it, and by the time that it's back out into the field. So this data profile is actually based on 2014 UDS. Now you may be saying, Allison, it's 2016. Things may have changed. And absolutely, we agree and we understand. Just based on the availability of the data, we have the 2014 data here. And so, again, just keep that perspective in mind of, okay, this data profile is a little bit behind. It really shouldn't affect too much the big things, but the descriptive attributes here at the top are really to say, hey, we took this data profile snapshot of your health center, and this is what your health center organization and your service area looked like at the time that we took that picture. Really just puts you back in the time and the place when your health center and your service area looked like this. This is what all your numbers were doing. So our experience has been over the past year and a half that the main things that may have changed and that you may look at and say, hey, that's not right, are some of the small things here in this descriptive section, especially things like PCMH recognition. So that data point, for example, comes from a Bureau of Primary Health Care internal data set. They gave it to us again at a very specific time, and we loaded in. And so you may have, maybe you didn't have it when BIPIC gave us that data set, and you do have it now, and you look and you say, hey, we do have PCMH recognition, and we worked really hard on that. Absolutely understood. That's just a small piece of the puzzle. I'm going to talk later how you can find out when this data was from and where it came from, and how you can check back in with us on saying, hey, you know, I have a question about whether or not this data is accurate. But this descriptive section at the top, pretty self-explanatory. On the left, you see some stats on your health center organization, all different kinds of things, including your HPSA score. And then on the right is your service area information. And so we also have that moving down the data profile, there's a map section sort of right in the middle there. This is still part of that descriptive attributes section where we're saying, hey, we took a picture of your health center for this data profile. This is what your health center looked like then. The map, well, we thought it was pretty and illustrative. Those little yellow dots are delivery sites, and you know, sometimes if they're really close together based on the scale of the map, you know, one dot will overlap the other. It's not super important, you know, but we encourage you to check it and let us know if you find anything there. But the most important thing here is to look at that dark blue shaded area, because that's what we have as your core service area, and that's where you get 75% of your patients. So when I'm talking on this data profile about your service area, I'm really meaning that core service area. And so the blue area on the map will give you, again, a good sense of what we mean when we say service area, give you some context for that. But the main, most exciting part is the bottom of the front page of your data profile. And I've broken it up into two sections here. We're going to spend some time going through it. So the first little section here is all the recruitment factors. Now, again, we've been streamlining and thinking about the data points that we include here. We worked with a team of experts on our side, as well as we got feedback from health centers, from PCAs, and from Bureau of Primary Health Care staff about which data points to include. And we settled on this list, but as always, would love to hear your feedback on what you think, what you really love, what you would love to see, etc. But we have recruitment factors here, and they're broken into two sections. On the top, you'll see health center data points, health center specific data points, and the bottom there is service area specific data points. Now, looking at those health center data points, you'll see a lot of them are National Health Service Corps. I mentioned that we are a National Health Service Corps group here at ACU, so that's part of the reason they're there, but also because we want to be supportive of that very effective national program that we know a lot of you take advantage of, and we know that actually a lot of you maybe are not taking advantage of. And so we looked at a lot of different National Health Service Corps data points. You can see that they're numbered here, 1, 2, 3, 4, 5, all the way through 11 at the top. And that's really to help you keep track of which is what when you're talking to one of your team members, when you're talking to us, when you're talking to whoever about the data point. It's a lot easier, we found, if you can just say, hey, recruitment, health center, number 11. So that's really just there for communication purposes and to help sure everyone's on the same page. You don't need to worry about that being a priority list or anything like that. That's just to help you keep track of it. So again, I mentioned we have National Health Service Corps. We also have a couple of other things that my excellent team has put together in terms of data. We do have things that maybe you don't necessarily think of when you think recruitment, but that we think could really affect recruitment. So for example, if you look at recruitment, health center, data point number 11, for your average profit and loss, that's actually a data point created by our team here that looks at your certain tables and data points from your UDS for actually 4 years and looked at whether or not basically you're going up or going down in terms of health center stability and financial stability. And so again, something we don't necessarily think of as, hey, this is going to affect recruitment, but I think that you can all imagine how some changes, how maybe if the health center is losing money or if it's growing really fast, could affect the outcome of your workforce programs. So there's a whole range of different things here. You'll see that it has your data point and it has your number, but that some of them, at this case, recruitment service area number 4, dentists per 100,000 population, has colored in blue. Now we call that a blue flag. And basically what we do is for each of these data points, we put them all together. For every health center nationally, we put all the health centers' numbers together, and we do some national benchmarking. And if you're an outlier on that specific data point when compared to all other health centers in a way that we think could affect your workforce recruitment or retention program, we shade your number in here with one of these blue flags to really draw your eye and say, hey, I have this whole page of numbers. What are the most important things I want to look at first? And you really want to look at those blue flags first. And that is not necessarily a, hey, you're doing this really poorly or this is a real danger area. It's really to say, hey, you should check into this here. You know, we have the data, and this data profile is full of numbers, but you really have the context for what's going on at your health center. And so all we can do is say, hey, based on the numbers, you're really an outlier for all health centers nationally on this specific issue. You should look into that and see why that is, and is that affecting your recruitment and retention at your health center? And if so, how can we work together to come up with a solution on that? So that's what those blue flags are, and I just want to encourage you again, when you get your profile, look for those blue flags first. So this is the recruitment data points. we also have retention data points, which I always think are super interesting and fun. You can see that we have retention health center data points, and then we also have just 3 service area data points here. The retention health center data points are actually, all of them are from your UDF 2014, so they're self-reported numbers. And then the service area stuff is from 2 other national data sets that we can talk about. But you can see on that last page, we saw that dentists per 100,000 population was flagged, meaning a low number of dentists in that service area. You can also see here, retention health center number 15, we look at the number of dentists this health center has, and that's also flagging as potentially a challenge. So you can see some alignment between the service area and the health center data, and also how some of your flags are connected to maybe one problem. There's not a lot of dentists in your area, and you don't have enough dentists. So that's really how some of those are connected, and you want to think big picture as you look at your blue flags. Don't get super overwhelmed if there are a lot of them. You can say, hey, maybe a couple of these are connected and it's one major systemic or area problem that I need to look into to think about how can I improve this at my health center. We also, you know, on the left you can see it's pretty standard stuff that you think of when you think of why are people happy or not happy, why are we recruiting or not retaining at my health center. We looked at your patient panel, we looked at your visits, your percent non-physician providers, your support ratios. But we also included some a little more outside of the box, if you will, things that I just wanted to mention because we get a lot of questions. So on the right column, it's Retention Health Center number 13. You can see we included clinical quality diabetes, and that's basically looking at what percentage of your health center patients are struggling with uncontrolled diabetes. And you may think, well, that seems more like a clinical issue, and I don't really understand why that's here. But again, this is trying to help you look at numbers and information you already know through that workforce lens to say, hey, okay, it looks like we have a lot of uncontrolled diabetes in our patient population. We know that's a clinical challenge, but how is that affecting clinician burnout? Do my health center staff, my clinicians, have all that they need to support this patient need? Are they getting frustrated by, you know, this situation, by this constant issue, by not being able to move the needle a little bit? And what can we do as a health center that both will change this and improve this clinical outcome, but also make sure that our clinicians feel like they're really supported? So maybe we can hire a diabetic health educator, or maybe we can partner and with a gym class and make some exercise classes at our health center. Maybe we can start a community garden. What can we do here to affect this clinical issue, but also to really support our clinicians and improve our retention of those clinicians? So that's why some of those are included. Same down at the bottom, we included a couple from the National Survey on Drug Use and Health that looked in your service area, the percentage of your population with either non-medical use of pain meds or illicit drug dependence abuse. Again, really not necessarily things that we think of as workforce challenges, but as you think really about some of the issues that challenge your clinicians and make them maybe frustrated or feel that burnout or kind of feel the real heavy burdens of their very important work, you know, we included these things to say, what can you as a health center do to really support your clinicians and make this a great place to work? So this is really the front version. We have the top stuff, the top data points in the map, that's your descriptive information, and then we had the recruitment data points and the retention data points. Now you may be sitting to yourself thinking, oh, this is kind of cool, but Allison, how do I know what any of this means? It's too much stuff, it's too many words, it's too much numbers. Don't worry, friends, we have a user guide for that. So here's a little clip. We're going to do the same thing with the user guide that we just did with the profile and sort of go through it piece by piece. This is kind of a long, very detailed PDF. It's available on our site. It was emailed out to all of you. If you have trouble locating it, just shoot us an email and we'll make sure that you get a copy. But it's important to remember that knowledge is power, my friends. So learn to love your user guide, because this is the source of all information about what's going on in your profile and what's going on with all this data nationally. So right now we're looking at Retention Health Center, the Retention Health Center page, looking at all those data points. And so when you get your profile, you're going to get it, you're going to look at it. Let's say that you had that profile that we just looked like that, and there were a lot of blue flags on that Retention Health Center area. What you're going to want to do is go to the user guide and go to this Retention Health Center page and then go through each of the columns. So you can see the measure column. So the first column, the text there is exactly what the text is on your data profile. Again, we added numbers this year, so you can say, oh, that was, you know, Retention Health Center number 3, and then quickly flip over here and find number 3 and start your work. So that's what the measure column is. The source column is going to tell you exactly where we got that data. So we included, for example, that this is from UDS, but we included also what specific table it's in. So if any numbers are really surprising to you, or you think, I'm not sure that's right, or whatever, you can just go directly to your own UDS and say, oh, yep, that's what we reported, or wait, I'm still confused, I want to talk to somebody about this. So you want to start here. Go to your measure, your source. The next column is a description column, and that's really explaining to you in plain English what we mean. A lot of these data points can be slightly complicated or just a little bit sophisticated, or just need a lot of words to understand what they mean. And we couldn't fit all of those on the data profile. So we made this description column to tell you a little bit more about what exactly it is. So some of them aren't that difficult to guess. So if we look at the second row, the actual data point is med provider per FTE. And here you can see what that actually means is your medical patients per your medical provider FTE, and that does include both physicians and non-physicians. So if you ever have a question about what does this data point mean, go to this description column and find out, again in plain English, what's really happening here. But really the most interesting bit, the most exciting for us, and what we see as some of the real value for you is this last section of the user guide, these last columns, because you really can't get this anywhere else. And what we've done is, as I mentioned, we put all those health centers numbers together, and here we've benchmarked them nationally by percentiles. So you can see the 10th, 25th, 50th, 75th, and 90th percentiles for every single data point that's listed on your data profile, and you can see what really is happening at all health centers generally. So I'm going to go back to that second row that we know is your patient panel per your medical provider FTE. And if you look at the measure centile sections, ignore the part that's circled for right now, you can see that for health centers, that patient panel per med provider FTE ranges from below 609 to over 1,316. So these aren't the absolute limits on either end. This is kind of the 609 is the top of the 10th percentile, and 1316 is the bottom of the top 10% there. But it'll give you a good sense of the range of what's going on at health centers nationally. Now, if you look for that part that's circled, that flag threshold, you can see where we gave a blue flag to. So sometimes, depending on the data point, sometimes we gave you a blue flag if you were in that top 10%, and sometimes we gave you a blue flag if you were in that bottom 10%. So that first row there, you can see that goes from 14 to 230. That looks at the average number of months that your CEO and CMO have been there. So we flagged on the bottom of that threshold. You can see in the threshold column that we flagged if you're 14 or below. Again, this is not to say, oh, you're all doomed and everything's horrible. If you know, your average number of months for your CEO, CMO is 14 or less, but just to say, hey, you're really kind of an outlier compared to other health centers. Look at this. How is this maybe affecting people's interest in coming to your health center? Maybe people left because they retired when the CEO retired, or really just gives you a chance to look into what's really going on at your workforce program. So you can see we flagged low there. But then on the next row, that one we were looking at, we flagged high. So if you were at the high end of your patient panel per per provider, then we give you a blue flag there to say, hey, just so you know, your providers, your medical providers have a higher patient panel than 90% of health centers. And so that's something to look at. Is there a reason? How's that affecting your clinician satisfaction? Is there any way you can change that number? All of those things. So this section of the user guide is so exciting and so interesting, and there's a lot of really interesting information here. We included even the distribution curve, so you can see kind of how everything falls out. For all of these ones, it looks like things just go from top to bottom. There's not a lot of yes or no. But sometimes the distribution curves are really flat unless you're in the top 10%, and then boom, the number goes really up. So when you get your profile, I'll say it again, look for your blue flags. Come here to this user guide, look at what it all means, see where you're falling, but then also take some time to go through each of the data points and find out where you fall on these benchmarks. Because maybe your number is 1310 for that patient provider, and so you're not getting flagged in the top 10% because you're not quite at 1316, but you are dangerously close, my friend. So really taking the time to go through each row of this user guide next to your data profile is going to be really helpful to give you a lot of context in terms of the data and where your health center is falling and performing. And because of all of the data points we've included here, you're going to be able to start to see, hopefully a lot of relationship between data points and where you're flagging. So that's the basic thing, your data profile and your user guide. I mentioned that we added a back section. So this year we included the back of the user guide is now your trend report. It has a lot of great data here, but the main gist is that it shows you your numbers from last year's data profile and this year's data profile, and it shows you which things you had flags on. So those blue flags correspond to the blue flags on the front, and you can kind of see some changes. So even here, if we look at recruitment number 6, NHSD dentist placement per current staff, you went from 12% to 78%. Now you have a blue flag. Really, I can tell you right now, that means that person had at least one dentist placement there, National Health Service Corps dentist placement. And so that's great. You're using the program. A lot of the National Health Service Corps ones, we flagged you if you're high just to say, hey, we love that you're using this program, but make sure you're not leaning too heavily on it and that you can develop other workforce recruitment retention programs. So we just included this trend report. You can see how your information changes from year to year, and we're gonna keep that up moving forward. So the number one thing, I've said it a couple times now, but I'm not afraid to say it again, my friends, is that when you get your profile, you want to first look for those blue flags and then review your user guide to say, hey, what are these blue flags? What is this even measuring? What is my number? How different is it from other health centers' numbers? And then you want to look, really, you want to add your own context. So why is this number this way? So we've heard from lots of people saying, hey, I have an explanation for this blue flag, I'm not in trouble. Number one, you're never in trouble. This is absolutely just a tool for you all. But number two, absolutely, you guys are the ones with the context, and because UDS is reported a certain way, or because of the timing, there could absolutely be a great reason. So, for example, we heard from a health center who had 0 LCSWs on staff, and so they'd gotten a little blue flag, and that health center CEO said, well, that's because we contract out all of that, and so we actually have these very robust LCSW services, but they just don't show up on our UDS because of the way we have it contracted. Great, excellent. That is great context. If something like that happens to you and you look and you say, oh, I know what that is, I know who this is or what happened here, then great. You can say, make a note of it, no major issue here, I actually feel good about this, we can just move on to the next blue flag. However, if you find something like, let's say you have a blue flag for that patient patient panel per provider data point, and you say, wow, I did not realize that our numbers were so out of line with what other health centers are doing. And, you know, my clinicians have been mentioning to me that they're really feeling overburdened, and, you know, maybe I thought it's not that really big a deal. These are the marketplace standards, but I see now that maybe it's a little out of line, and I want to do something to change that number. That's really when you get to the last section, and that's really looking for a solution to that challenge. And that's what we're here for. That's what our team of consultants is here for. That's what your primary care association is here for. There's lots of places that you can go to talk through this issue and get resources and support. So again, this data profile is really just a tool for you to figure out where to start and what things might be affecting your workforce program that you hadn't necessarily thought of. So we do all kinds of data analysis with this. We do have state reports coming. They will be coming, you know, sometime in the next month, and those get shared with your PCAs and your primary care associations, and they'll be available for you all as well if you want to take a look at the state report. Those state reports really will give you some information on, you know, where are the areas of high need in your state. So what we look at is the number of flags and what percentage of health centers got a blue flag for any given data point. So it's a good way for you to look at your own profile and say, here are my flags. This is what the state looks like. Am I pretty much in line with health centers in my state, yes or no? If yes, I see actually it looks like most of the problems are, you know, confined to, you know, 3 to 5 data points. Let's talk with our state organizations, our PCAs, our PCOs, other people that help us talk about, hey, we know this is a challenge in our whole state. How do we really work on this? And then we're also going to be adding some supplementary reports, so write up some special pops, a national data review, some one-pagers that will help you if you have a blue flag on this issue, what should you do, what does it mean? All that stuff is also coming over the next month. So if that's all going to be available on our website, you can just sign up for our newsletter. We have a monthly newsletter. That sign up is available on our homepage of chcworkforce.org, and that way you'll be up to date the second something goes out, and you'll get information on that. So lots of data analysis for us, and really, you know, the last big piece I wanted to mention is just really what this cycle is. We have the profiles, we get PCA, PCO feedback, we release them to health centers, and we get health center feedback, and we start this whole cycle over again. So this is the second cycle that we're doing this. You're going to get a new profile every year with updated information. But definitely we need your feedback. We have had questions in the past about who sees these profiles, and the short answer is just you. We, as I mentioned, emailed out the data profiles to whoever was listed as your health center CEO on your 2014 EDS. So if that's changed, that may be a reason that you or your CEO did not get it. Please be in touch with us about that. Your PCAs and your PCOs have the opportunity to receive the individual profile if they sign a confidentiality agreement with us and with Bureau of Primary Health Care, meaning that they're not going to share the information. It's really just provided to them so they can do their own state workforce planning in terms of training and technical assistance. So if you have any questions about that, please get in touch with us. But the important thing to know is that these are confidential profiles. Your data profile will never be posted online or shared anywhere or any of that. These are really a tool for you all to look at your data, and a tool for us at a national level to do some planning on what are the real workforce needs, where are they, are there pockets of regions or states or whatever experiencing certain issues. But none of it is any good unless we get your feedback about what works and what does not work about the profiles. So please review them, and please get in touch and say, hey, I love this, I hate this, I don't understand this, whatever the case may be. We are here to help you and to serve you on that. So main next steps is for you to review your profile in the user guide. You can get in touch with us if you don't have either of those things, but go through it. We suggest going through it with your team. And then online you can also complete, we have a really great self-assessment tool. It's available on the resources page, just right there at the bottom. That's a great step if you want to do some strategic planning with your health center team, and you'll have your profile and the user guide, but then you can also complete this online self-assessment. It's about 25 questions. It goes through a whole range of issues, and really lets you and your team get on the same page about what's really going on at your workforce program. So it will also give you some automatic feedback via email based on what you answer. So complete that self-assessment tool with your team, go through the profile and user guide with your team, and then you're going to have all kinds of information, data, context, all different kinds of things to really talk about what's going on with your program and what you may want to or need to change. You can also call us. Get in touch with us if you want to go through your own individual profile with one of our team. We are available and would love to do that. We love looking at the profiles. So get in touch with us, and we'll be happy to do that call. You can also just request technical assistance from a workforce expert. We have a team of consultants who do phone consultations, and basically how that works is we pay for it. So it's no cost to the health center. We use our National Cooperative Agreement dollars to manage that, and basically we'll set you up with an expert depending on what your issue or question is. And you get some free phone time with them to talk through any issues or questions you're having about either the data profile or about your workforce issues in general. So I'm going to mention it again, chcworkforce.org. That's where you want to go for your next stop stuff. And that's actually, mercifully, the end of my talking. So you can check out all of that stuff online, and we have plenty of time for questions. So I'm going to pause, give you a moment to take it all in, and ask Mariah if we have any questions coming in on the line.
Actually, we did receive one a little while back, just to get us started here. Why is it better to have the CEO and CMO at the community health center for a longer time rather than a shorter time?
So I guess I'll say it's not necessarily better. Absolutely, the argument can be made that somebody has been there for too long, and they're out of touch with something. And just as well as the argument can be made that a brand new person doesn't really know the culture of the health center or whatever. There can be arguments made on either side. We decided to cut on the low end because we thought it might be an indication of big level change at the health center. And maybe those changes, depending on the reason for them, might affect general stability or feeling of clinicians' connections. Maybe health centers stayed for a long time because they love their CEO, and they hung in there even when they were ready to retire or move on, and the CEO retired and they left. There's lots of things that could be going on. But again, these data points are just a starting point for you to unpack. So we flagged on the low end because we thought it might be a marker of just general change at the health center, which can be challenging for all aspects of operation, but definitely in terms of recruitment retention. But absolutely an argument can be made either way, and that's up to your own discretion as you're going through your own data profile and thinking about the issue. And that really can be said for a lot of the other data points. I mentioned that we flag high on the National Health Service Score because we love that you're using it. We want you to use it. But also, we know some health centers get really dependent on it and they don't actually develop other recruitment mechanisms because let's say they always get, their HPSA score is high, so they always get something. And it's better to have a diversified portfolio of recruitment and retention techniques, and so that's why we flagged high. But you could very well make the argument, hey, this person has a HPSA score of 19, and I can see that they have 0%, meaning they're not posting any vacancies, they don't have any placements at all through National Health Service Score. That's not a good use of a good program. And so arguments can be made either way. The important thing is that you bring the context to what's going on with your data profile. And again, we're available to talk through the highs and lows, the yeses and nos for each of the data points if you have questions or want to talk through, hey, I don't really get why this might be bad or why this might be good. But thank you very much for that question. Anybody else? You can put your questions into the chat box and also into the questions box, and we'll shout them out here. I will say, while we're seeing if anybody has any immediate questions, that we're going to have more resources on these available. This recording is going to be available. We're here all the time if you want to call us and talk about your specific profile. And we love suggestions and feedback. It's my favorite thing. So if you have an idea, let's say, hey, it would be cool if you had X related to this data, please give us a call, send us an email, let us know. And vice versa, if you're saying, hey, I think you haven't really thought about this thing, let's talk about that. We would love to have that conversation with you.
We did just receive a question about one of our next steps here, about the self-assessment that we have on our website. Do you recommend one health center contact completing it, multiple people completing it independently, or a whole team of folks sitting down and completing it together?
So we would suggest that a whole team complete it depending on your health center makeup. So I don't know, it will depend on how many people at your health center work on the recruitment and retention issues there. But we recommend that everybody involved in recruitment, and definitely your CMO and your CEO on the retention side of things, should be involved. We found that usually one person knows parts of the questions and another person knows other parts of the questions, and both people are really great at what they're doing and they're on top of it, but they don't necessarily share that information together, and they don't necessarily know how it fits together. So a really great process is for you as a team, anybody who touches recruitment and retention, that's usually CEO, CMO, your HR director, anybody else who handles interviews or does the scheduling or whatever, have everyone all together to go through that self-assessment. And that way everybody can learn a little bit else about what the other team members are doing and what their process is and their priorities. And then also you can have all of the information all together at one time. And so that's web-based. Again, it's online, and you'll get some immediate feedback via email. And then also we do see on our end your answers. So if you do it all together and you have questions and you're like, oh my gosh, I don't know, I didn't realize this was happening, we need help, you can call us, and that way we have all the information and you don't have to tell us, hey, this is who we are, this is what's happening. We already know what's going on with you all and can talk you through whatever you need. And we have lots of exciting tools on our resource center. It's pretty comprehensive in terms of tools we create as well as tools others have created that we think are great. We will have incoming a financial assessment tool. It's this beautiful little calculator that members of my team from John Snow Inc. Put together, where you can put inputs for all different kinds of financial elements, and then it'll kick out calculations for how much it costs when a clinician leaves your health center, how much it costs to recruit, let's say, a physician, any of those kinds of things. So we have lots of those cool tools out there. That one's coming. It's just pending bureau review. So again, you can sign up for a newsletter to find out more. And if you have questions about any of these resources, as always, please get in touch. My direct contact information is on your screen now. Our general STAR Center contact information is on your screen, and you can also contact us through the website. So we're here all the time. So Mariah, any more questions come in?
Nope. It looks like our questions have slowed down.
Okay. Well, I'm going to take that as a sign, my friends, that I've done an excellent, flawless job at explaining this to you. But on the off chance that other things occur to you as you sit and look through your own profile or go through, I'll say it just one more time, please call us, please email us. We'd love to talk with you about this project, about your specific data profile, about your specific challenges or needs, and we are here to help you. So thank you so much for everything that you've done to make time to come and join us here, and everything that you're going to do to follow up on those next steps that I mentioned. And we look forward to talking with you hopefully very soon. Thank you so much.